So, good day everyone. My name is Precious S. Dalina, a registered midwife and a fourth year BSM student of Ticaro College Foundation Incorporated. So, now I am going to discuss the Philippine Cancer Control Program. So, here we will know the programs that are being implemented and developed in response to the increasing cancer cases, or the programs to reduce the impact of cancer. So let us start. Let's have first the overview of cancer. So cancer is one of the four epidemic non-communicable diseases, or the NCDs, which include cardiovascular diseases, diabetes mellitus, and chronic respiratory diseases. So si cancer isa po siya ka non-communicable disease. So those non-communicable diseases that are being mentioned above share common risk factors such as tobacco use, unhealthy diet, insufficient physical activity, and harmful use of alcohol. So, cancer is the third leading cause of morbidity and mortality in the country after diseases of the heart and vascular system, according to the Philippine Health Statistic 2009. So, grabe gyud ay ang cases sa cancer diri sa Pilipinas, no? Kay imagine, ika-third leading cause of death siya diri sa Pilipinas. So, what are the common sites? So, the common sites of cancer among Filipino men were lung. First, lung, kay kasagaran sa mga lalaki is smokers. That is why kasagaran po sa ilahan nagka lung cancer. So, next to lung is liver, colon or rectum, prostate, stomach, and leukemia. While sa Filipino women were breast, cervix, lung, colon or rectum, ovary, and liver. So, in response to the growing and alarming epidemic of cancer, there is a need to revisit and strengthen the Philippine Cancer Control Program, which started in 1990 through Administrative Order number 89-A series of 1990, amending AO number 188-A series of 1973. So actually, it was all started in 1973 sa the Administrative Order number 188-A pa that time. However, the cases of cancer are increasing and growing, so the committee is planning to make an additional programs or policies and or guidelines to reduce the impact of cancer. Kay that time sa the dating administrative order parang kulang pa, kay naga-increase pa gihapon ang mga cases sa cancer. So that is why there is a need to add more programs. So that is why in 1990, the Administrative Order number 188-A series of 1973 amended or changed into Administrative Order number 89-A series of 1990. So sa 1990, mao na to siya ang Administrative Order number 89-A. So the National Cancer Control Committee, or the NCCC, developed the National Cancer Prevention and Control Action Plan, or the NCPCAP 2015 to 2020. So, first, what is the role of NCCC anyway, the National Cancer Control Committee? So, this is the organization or the committee who plan, establish, or implement policies and guidelines and many more in relation to cancer para ma-reduce. Sila ang nag-establish ng mga programs para ma-reduce ang impact sa cancer or ma-reduce ang mga cancer cases. So, they implement the National Cancer Prevention and Control Action Plan. So, this serves as guidelines of the Philippine Cancer Control Program, kaning NCPCAP, which is ang gi-implement sa Cancer Control Committee. So next, what is the mission? The mission is to reduce the impact of cancer and improve the well-being of Filipino with cancer and their families. And the vision is to have comprehensive cancer care and optimized cancer survival in 2025. Next, let us proceed to the objectives. So first, objective is to reduce premature mortality from cancer by 25% in 2025 and to ensure relative reduction of the risk factors for cancer, to guarantee the availability of the services for selected population, and to have comprehensive cancer care and optimized cancer survival in 2025. So, mauna ni siya ang National Cancer Prevention and Control Action Plan. Katong akong na-mention kaganina nga guidelines sa Philippine Cancer Control Program. So, this shall cover the following care areas of concern. First, the policy and standard development. So the first, development of national policy on the integration of palliative and hospice care into the Philippine healthcare system. So the healthcare system would not be complete without the palliative and hospice care. So what do we mean by this? So palliative care is providing care or specialized medical care that focuses on providing patients relief from pain. It means to improve the quality of life not only for the patients but also for the family. Palliative care is offered alongside curative, meaning providing care for those patients nga pwede pa siya makasurvive. So, for those curative, it is an ongoing care siya until rehabilitation in coordination with the families. That is why involved ang family kay you support the patient kauban iyahang family. So, ikaw healthcare provider, you coordinate with the family to support the patient. So, while the hospice care, it is a special kind of care that focuses on compassionate care for people in the last phase of incurable diseases, so they may live as comfortably as possible. It is providing care in terms of emotional or mental, because this is the phase of their lives that they may feel worthless. So naa na ang anxiety kay kabalo naman sila sa ilang self nga dili na sila makasurvive. So that is why kita healthcare provider must support them emotionally and mentally. So next, development and operationalization of National Cancer Prevention and Control website and social media sites. So there must be a website para madali lang ang pag-access. And next is development of comprehensive national policy on cancer prevention and control. So when we say comprehensive, it should be planned, systematic, or organized. So the plan should be specific na ma-address sa mga programs ang burden of cancer. Kung sa tong problema about sa cancer, kung nag-grow ba ang cancer, dapat ma-response to siya. In other words, ma-response dapat sa mga policies ang increasing rate of cancer or ma-achieve ang goal. So next, establishment of National Cancer Center and Strategic Satellite Center. So halimbawa sa Davao may cancer center man sa SPMC. So that is considered as satellite cancer center for those hospitals na may mga cancer centers. So last is Last is the expansion of PhilHealth Z benefit package coverage to other cancers. So, kung may PhilHealth ka, makaabel ka sa package, wala kay bayaran, kay included man dito ang mga expenses like medicine, expenses, rooms, and doctor's fee. So next is the advocacy and promotion. So under the advocacy and promotion, we have the cancer health awareness concern. So sa January, dira gina-celebrate ang National Cancer Consciousness Week. Sa March naman, colon and rectal cancer awareness month. In April, we have Cancer in Children Awareness Month. In September, the Liver Cancer Awareness Month. Sa October, Breast Cancer Awareness Month. Last is the November. Dito gina-celebrate ang Cancer Pain Awareness Month. So next, these programs is being implemented in partnership with these agencies. So first is the Department of Health. Why we need to coordinate with the Department of Health? Because kay may mga school-based vaccination among elementary schoolers and kailangan ang approval ng DepEd. So that is why we need to coordinate with them. So next is the Civil Service Commission. So sila ang mga nag-offer og work for those cancer survivor, for kay may mga company man nga dili na sila mag-accept og mga cancer survivor kay lagi basig dili na nila kaya. So mao na siya, ang Civil Service Commission is mag-provide sila og mga work nga para sa ilaha og pwede sila didto. So third is the Commission on Higher Education, or the CHED. So the CHED support, why do we need to coordinate with the CHED? Because the CHED supports research about cancer or research for cancer control, kung paano ma-reduce, kung paano mapugan ang cancer. So ginasupport nila ang mga research. So ang CHED, ginasupport nila itong mga universities or colleges na nag-offer og courses related to cancer, like mga doctors o oncologists na sa ilang curriculum. So mo lang gina-supportahan sa CHED mga research, mga curriculum, like nag-offer og courses like oncologist. So last is the Bureau of Working Conditions. So same lang sila sa Civil Service Commission. And then next is the service delivery. First, the availability of free cervical cancer screening in all trained RHUs. So next, availability of cryotherapy equipment in every province. Availability and accessibility of screenings for selected cancers in all trained RHUs. So dapat may mga medicine access pod sa mga RHUs and free screening for early detection. And school-based HPV vaccination on 9 to 13-year-old female. So mo ni ako na-mention kaganina nga need og approval sa Department of Health. And then last is hepatitis B vaccination for all health workers nationwide. So here dili lang patient ang dapat protektahan. The health workers should also protected with hepatitis B vaccine. Next is the information management and surveillance. First is the establishment of National Cancer Registry, hospital and population-based dapat siya. So, because the National Cancer Registry will measure the progress in preventing and treating cancer as well as the leading cause of death. So, here we will know if effective ba ang programs na gina-implement, kay makita nato diri if naga-reduce ba ang case or is it increasing. So, with that, the organization will take action. So, dapat may hospital and population-based. Next is the development and operationalization of cancer helpline including telemedicine. So, cancer helpline, kailangan og helpline kay mga may mga individual that they are looking for information, assistance, or advice on cancer related topics. So, this will be answered by the oncologist or mga health professionals. So, that's all. That would be all, and thank you. Thank you for listening. I hope naamoy na learn sa ako ang discussion today.